I'm Dr. Mandy Kirk from Move to Success Physical Therapy, and today's video is going to be about creeping versus crawling and ways to get your baby up onto hands and knees and work on crawling or creeping. So first of all, creeping versus crawling. So when we think of crawling, we often think of going on hands and knees and crawling, but that's actually the PT term for that is creeping. So crawling is more like a military crawl, like being down more flat and doing a military crawl across the ground, whereas creeping is up on hands and knees. So I often see kiddos who don't want to be on hands and knees, or they don't like to be in a position where they can creep. So I wanted to show a couple strategies with my handy baby here to work on hands and knees position and proper creeping. So a lot of times the reason why kiddos don't want to go up onto hands and knees is because it's either too difficult for their shoulders or it's a lot of balance and coordination that they're not comfortable with, as well as core strength. So a couple strategies that we work on is getting kids up into high kneel, which is on knees, and have them supporting their hands on a higher surface. So I have a step here that I might put some toys up on and have baby play up on the step. So this is a position that's not quite hands and knees, but it's a good way to start weight bearing on the knees and weight bearing on the hands and putting just a little bit of pressure like this through the surface, and it's not fully on hands and knees. So I like to use toys as motivators because obviously they'd be more inclined, baby would be more inclined to stay in this tall kneel position with hands up here if there's toys that are interesting to play, and it's also a really good core strengthener. Another way to get baby up onto hands and knees is to use either your thigh or your lower leg to support them, and then you can kind of put your hands right below their butt here to keep them on knees, and then let their hands hang down here and weight bear. So that's like a supported hands and knees position. I really like that one. You can also use something like a wedge or a half roll if you don't want to use your leg for a long period of time to keep them on that hands and knees position. To work on crawling, you can flip baby over onto their back. And I did talk about this one in my last video as well, but working on bringing opposite arms and legs together to kind of get the coordination of moving one and then the other and getting that cross body core strengthening. You can also use, so I have arm immobilizers here. So we use arm immobilizers for a lot of different things, and they Velcro open and they Velcro closed. They go right over the elbow here to keep the elbow straight. So if it's an issue with baby doesn't like to weight bear through the arms, they're bending or they're falling on their face a lot because they don't have the shoulder strength or the elbow strength to be able to lock out, these might be helpful to kind of train that position so that they weight bear all the way through their shoulder into straight arms onto hands and knees. And then to actually get the crawling position, besides just putting baby on hands and knees and scooching them one leg, one hand, one leg, one hand, which is something that I work on a lot at the clinic with my kiddos, you can put a towel. So I'm just using a hand towel here, but for a bigger kid you can use like a folded, more like a bath towel, and lift them up so that they're on hands and knees here and you're supporting them at their stomach, and allow them to move their hands forward to try to get an object that's a little further on the floor. So something that I like to tell parents is to give kids about a 70% success rate when they try to grasp different objects or get to a result, because it helps to positively motivate them to continue to try. So if you try your child 10 times, help them to get to their end result, get to the toy that they want to get to 7 out of 10 of those times. That way it's a positive reinforcement for them. So I hope that that helps. If you have any questions for me or other ideas, feel free to post. You can ask me on my Facebook or Instagram, or you can post underneath this video. And like and subscribe. Thank you so much.